honest questions with honest answers. This is Unfiltered, brought to you by the Emergency Medical Minute. All right, so welcome back. We are in Unfiltered. This is Nick Sippis, your host, and I'm honored to have the dynamic duo of doctors Katie and Pete Bakes, the legendary ER couple of the great city of Denver and the great state of Colorado. Welcome.
Might be a little overstated, but thank you.
You can't possibly overstate the Bakes.
I feel like you couldn't get anyone else to interview today.
Well, it will be worth what we paid you to be here. I can promise you that.
We're getting paid?
That is a whopping $0. Big handshake, free bottle of water.
At least we're not getting fined.
High budget. I'm just here so I don't get fined. High budget production here. So if you wouldn't mind introducing yourselves to our group of listeners with your current position and what occupies your time kind of extra clinically too, because I think it'll be interesting to talk about that. Pete, do you want to go first?
Sure. So my name is Pete Bakes. I've been an ER doctor in the community here at Swedish Hospital in Denver this is my 19th year. Outside of work, I spend a lot of time raising a family. We have three little girls that we love. The oldest one of which is 18 and 16 and 13, Sam, Jess, and Avery, which are definitely what inspires us both, I think. And then outside of work, I'm involved in a small startup, tech startup that's sort of medically based. So I'm sure that'll come up a little bit. Mm-hmm. And then I do a little bit of community work with a pipeline program, getting kids some work-based training in ER setting. So that's basically what we're doing these days.
And I am Katie. I am Peter's wife.
and so much more.
That's the lowest line item on her CV.
It's actually at the very top. I'm a professor in emergency medicine at the University of Colorado School of Medicine. And I'm also the medical director of pre-health programs at Denver Health and the director of our hospital-based violence intervention program, AIM, at-risk intervention and mentoring. And
what else do you do, Katie?
And the primary caregiver for three beautiful young daughters.
But are you an astronaut?
Not yet.
5-year plan.
Yeah.
That's right. Get the kids out of the house and then focus on Mars. How did you guys meet? Do you want to tell us the story?
Yeah. So we met really early on in medical school. So it was actually the first time all of the students got together for an orientation. And
we actually didn't meet there. We never met.
This is being taped.
I know,
okay?
but I think you should tell the story right.
Okay. Why don't you go?
So we didn't meet until the dean's party. But
the dean's party.
The dean's party. Yeah, I may have drank a little too much.
Already a better start to the story than Pete's start. Keep going.
But so we had.
You're friends with me first.
But I'm more endearing.
Yeah. If she doesn't say so herself. Okay. Right.
Katie, please
You're lovely.
Don't mind us. Please continue.
I'm my most favorable critic.
Is anyone organizing this interview?
No, this
here?
is a total. No, it's a total free for all. I feel for the editors. They're not paid very well. They're underpaid for their job.
Yeah.
Is your editor Nate?
Yeah. Oh. Yeah. Cheap labor.
Are you paid at all?
Shout out Nate Navadi. No pay for editing.
Yeah.
All right, we're gonna wrap things up here.
Yeah,
soon,
exactly. That'll do it. All right. Thanks for coming out, everyone.
I'm missing a court date for this.
You are?
What? No, not today.
Oh, okay.
Although that's not far from the truth.
Follow-up question.
He got arrested once. Do you know about that?
Hey, whoa.
Was that the time you guys met, or that's a separate story?
Yeah, can you just stay on point?
No, but that's a really good story.
That's the next story.
We need to cover
that's
that.
the next episode. That's unfiltered. Okay, can you stay on task?
Yes. So we actually had our opening where all the med students got together for just a meet and greet. That was our first orientation event. And I saw him across the courtyard. And he was I don't know. There's something about him. Like, honestly, I never wanted to get married. I wanted to like travel the world and, I don't know, help people. And I know every med student wants to do that. But I think I really would have. But then I met Pete and everything, you know. I saw him across the courtyard, and I had made a friend who actually we ended up living with the following year. And I turned to her and I said, "Do you see that guy?" And he was making himself kind of diminutive. He was talking to this little female student who was with us, and who was in our class. And I said, "You see that guy?" And she's like, "Yeah." And I said, "That's the guy I'm going to marry."
Katie Bakes gets what she wants.
No, it wasn't like that. It wasn't like that.
Sight unseen.
Right off the lot.
Right. She kicked me in my calves. She's like, "Yeah, they're solid. I'll take them."
Good stock.
Turned out he was good stock as well.
Yeah.
But yeah. But no, it's just, and then we met at the dean's party. And I didn't like him as much at the dean's party.
You're like, maybe I should go help people.
Well, I know. Well, he kept making fun of me and being sarcastic, shockingly.
Mature.
And I was like, yeah, I don't know why I felt that way, because I had such a strong feeling when I saw him. I was maybe a little.
Yeah, she wasn't driving that night.
I gave him some fodder to make fun of me. For sure. I think I was talking about my grandmother being able to read tarot cards and tell the future. Yeah.
Does this relate to Pete being arrested later, or this is a separate story?
No, that was all him. That was all him.
Just answer the question.
But then we ran into each other again, maybe a month later, something like that, in the library. And I remember I was really angry about something, and I was walking to the elevator, and he was by the elevator in the library, and he had pulled out some book from the bookshelf and was just reading it. And I thought, oh my God, this is the last thing I need to see this guy. And then we ended up talking by that bookshelf for like 2 hours. And when I left, I was like, what was I angry about? and that was that.
I'm crying.
Yeah. You pulled that book out to look smart when she was walking by. You're like, yeah, renal physiology? Yeah, I read this for fun. Yeah, I don't...
Did you? Did you?
No, I did not.
Okay.
I was very
never
interested
thought
in
of
renal
that.
physiology. I had a lot of pictures. It was easy to understand.
So you guys, it was early on when you met, and now you've gone through kind of you trained together at UCLA and came out here afterward.
The time Peter was in the big house, we went through that.
Right. It's a dark time. We'll come back to that. We'll stay in the light for now, but we'll go to the dark.
I've paid my debt to society. I've been rehabilitated.
Pete, I'll start with you. How have you seen Katie change over the course of training and being an attending and a professor? What have you seen in her over the years?
So, I think from a professional level, I've seen a ton of growth. She's always been a curious, passionate person pursuing sort of her ultimate goal, which is, I think, to use medicine to help people. I think over the years...
It's technically what it's supposed to be about, right?
That
seems
passion,
reasonable.
Yeah.
Among other things.
As opposed to other people,
Can I get a word in?
Sorry. She's unique that way.
So she's always been passionate about expanding her sort of professional interests. She was selected to be chief resident of our residency. She did an ultrasound fellowship thereafter. She got, a coveted job here at Denver Health, and then soon after carved out her academic niche. She went back and did a pediatric emergency medicine residency, which was an additional sort of 2 years. All the while sort of raising our 3 girls and making sure that everything was taken care of at home with our family and with me. I think that one thing that has never changed is sort of her spirit, which is that she's always been, she always would go to her core value, which is, I'm here on this earth to help other people. And I think that when things got difficult, balancing time and effort with all those academic interests and trying to become a professor and dealing with a lot of the things that women have to feel when they're trying to balance career and family. I think that what came through was her real passion to help others, and I think that anyone who's met her sees that in her, and it's been something that has allowed our family to thrive throughout that whole process, overcoming the challenges that we've done.
This is awesome because words are my love language. So, like, I could just sit here forever.
How long did it take you to learn that words were her love language, Pete?
I think
I pointed out to
I
him
think
multiple times, and then
after our
eventually-
first date, she handed me like a laminated card.
Stick
Some
to the
suggested-
script.
Some suggested word, yeah.
I tell him I'm the perfect wife because I'll go, tell me I look pretty. And it's like, you look pretty. And I'm like, oh my gosh, thank you.
It's true. I mean,
And
she
it's
does
like,
look pretty.
it's as if he said it on his own. Honestly.
You definitely prefer that to things he would say on his own. That's my understanding.
It's good for things to be scripted sometimes,
Katie, can you elaborate on that? I mean, I think that's a great point, and I think a lot of the folks in our listener cohort would identify with that. Young women getting into a professional career and trying to balance the competing interests of starting a family and raising a family and your professional and academic goals. And as you look back, what was particularly helpful for you as you were trying to do that and clearly have done it well? Do you have any advice or thoughts about that?
I think the number one thing is having a partner that you love and respect and that is committed like you are to be part of that. And I can say 100% that we've been partners in it and done it together. So I think beyond that, I think we both would say that you kind of need a village to also help because I think people ask us a lot, how did you do that? And I go, I don't know how I did that.
One
We
day at a time.
We actually didn't.
I know. No, we have some family nearby and great friends and
The daycare providers.
Yeah.
And sort of
Yeah.
part of our lives ever since they took care of our kids when they were little.
yeah, we'd have them come and babysit. One really good tip for people out there, which I tell all young parents, is get a babysitter on the mornings of the weekend. Because I think obviously for emergency physicians, being able to sleep in is something that is just incredibly coveted in general when you have kids. And so rather than always having a time you have somebody come in for a date night, which sometimes when you have little kids and babies, a date night sounds exhausting. Mm-hmm. But have a sleep in night or a date at night in your own home where you have even if it's a community kid down the street who's 14, those are the best babysitters. And if you're home, you're not worried about having that babysitter with your little kid and your infant because you're still there. But I think we really looked forward to those either Saturdays or Sundays when we both had off. We love sleeping. We're both kind of night owls. If it was up to us, we would, sleep in every day. Actually, in med school, that's what we did. We didn't actually go to class.
Scandalous.
Well, we watched the lectures. They were ready for us when we woke up for that day. So we would sleep in. We would go listen to the lectures, and then we would stay up late. And that was our natural schedule, both of us. And so I think having that morning where you can sleep in together, you can have coffee in bed, you can just talk, you can go for a walk, ... is really important to to have that time where it's not that pressure to say, okay, where are we going to go and what are we going to do? Like sometimes that's just too much, and all you really need is some quality time together.
I mean, I would say that going through med school, which felt rigorous, and going through residency Before that, we had spent 3 months at the end of med school learning medical Spanish, and then going to Guatemala, which was I would say,
very traumatic event.
Yeah, I mean, really difficult experience for both of us. I think that, when you go through those types of hardships together when you're young, and you sort of feel fundamentally connected with the other person based on values, then it sort of gives you a lot of emotional reservoir to know that, you can handle anything as a team. And I mean, there was definitely times when I felt like there was struggle where we were trying to, be competent at work and be mindful with our family, but and things didn't always go great. But I think that having that foundation where for years during med school, residency, and then our time in Guatemala together, I think that we really just sort of learned to know that in the end, we're there for each other, and that we could really get through anything. I mean, I think it was really sort of a formative experience to do that. And I mean, I think that every relationship, especially if you have, two people that are motivated, that generally have different personalities, complementary personalities, but similar values, that, there's always going to be sort of struggle. And I think if you can just sort of rely on that foundation and have trust in the fact that you'll be there for each other in the end, then it sort of all works out. I think that's what my experience has been.
Agreed.
Katie, what have you seen in Pete? How has he changed over the years? Or not changed?
Sitting here with a hoodie.
I think we play a lot, even in our language, if you haven't picked that up. And I always say playing is really important in whatever form that is for your relationship. But that you need to have a lot of humor in a relationship, especially to be able to get through some of the tough stuff. And I don't know. I'm just so proud to be his wife. Honestly, he's such an amazing person, and he has so much character. Pete's always very analytically self-improving, so he's like, he always wants to accomplish something every day, and whether it's physically, intellectually, mentally.
I'm doing push-ups right now.
Looking good, baby. One hand.
I don't know how his shirt got off so fast. Is it real? You'll never know. That's why it's a podcast. Just trying to get the listeners up. That's all. Just trying to drum up
He
support.
looks good without his shirt on. He really does. Oh, you're blushing. You're so cute.
I'm going to go take a walk. You guys can take it from here, right?
It's usually it's like aimed at me. Someone's aimed at him. He doesn't know it. Look how uncomfortable he is right now. This is fun. No, he's I think become more thoughtful and more spiritual. And I don't know, his love has grown. I mean, I know mine has for him every day. I always tell him I love him more today than I did yesterday and the day we met. It's true. And I admire him a lot. I think being able to admire your partner is really important. But he's always growing and developing. I always worry I'm not doing that as much as he is.
I mean, I think one thing that helped me sort of, for lack of a better word, mature, is that, when we were going through sort of times where we were struggling to balance all of our priorities, I always would just sort of analyze and divide up responsibilities and then try and maintain accountability so that we could sort of optimize outcomes.
Just a spreadsheet of
Yeah, exactly.
Yeah.
Right. I mean, it was, and I think
we've had the classic like girl boy arguments, right? Where he says, "No, this is what I said," and I said, "It's not what you said. It's
But
how
it's not
you
what you
said
meant
it."
or how you said it, right?
Right. It's how you said it.
yeah. I learned after several years that I had to make a choice between being always right or always happy. So, it's like
That's really good.
yeah, and like so above our kitchen table or above our kitchen sink, we have a biblical verse from Corinthians, and I think everyone's sort of familiar with it. But it's it starts with love is patient, love is kind, and then at the end it says it persists. But in between, I think it gives like something that when I read it the first time, I felt like I really had an epiphany, and it says it records no wrongs. And I think that was something that as someone who is really analytical and process oriented and looking to optimize, taking an approach to raising a family, that's not the right way to be when you're trying to do it with a true partner. So I think that Katie's taught me. She's sort of the paradigm of empathy, and I think that she really just always looks at the positive in people, and I mean it's contagious, and I wasn't immune to it.
Oh, isn't that so well said?
He is from time to time quite articulate.
I know.
All right, I'm gonna put down my notes now.
All right, yeah.
I feel like
Let's go off script for a minute.
now we can talk about my criminal record.
This idea of empathy. Brief shout out to the book Bring 'Em All, made by one of our own, Don Stater, and 50th anniversary for ASAP. I get no
Right.
kickbacks from mentioning this, but Katie is featured prominently in that book, and it's a book full of compelling stories, but I think yours is particularly compelling for a number of reasons. But you touch on empathy in that book, and you touch on how there was a time in your training when you felt like that had been eroded from you, and how it took kind of a mindful effort to get that back, or to stem the tide and eventually rebuild it. Can you talk a little bit about that process?
Yeah.
I can't imagine a topic that's more
Yeah.
relevant for us as emergency providers and in our field.
I think and I've talked to residents a lot about this too, because I think whenever you feel like, and this happened to me in residency, and whenever you feel like you're disconnected from the patient or your calling or why you went into medicine, and that can very much happen in emergency medicine. It doesn't only take away from your work and how you treat patients and the kind of doctor you'd wanted to be, but it really does start to chip away at the image you have of yourself. And I think that is often why physicians end up being very cynical. I always say the cynic is not the person who doesn't care. Like, we know who that person looks like. The cynic is the person who feels helpless and feels that their optimism has been disappointed, and that they don't feel that they have control over that situation. And so I also tell them, that I believe empathy is a muscle you have to exercise, just like anything. That everybody who goes into, and it's any helping profession, I mean, whether it's police, fire, emergency medicine, whatever, people go into those because teachers, they want to help others, right? They want to invest in others. And when that starts, what you imagine that to be is dispelled, everything starts to crumble around that. Like, who are you? Why did you decide to do this? Should I be a doctor? Because I don't like my patient in front of me, right? And that's a very common feeling. And I'm not going to tell you I love every patient, but I love 99% of my patients, right? And I felt like there was this one day in residency, my second year, where I really wasn't feeling that with my work and when I was interacting with patients, and it was very disconcerting to me. And I said, I don't want to be like that. I don't want to be a doctor that's not enjoying that experience. And so right before I went into every room, I would tell myself, this is somebody, and this is about them. And I had to do that for about a year. before I didn't have to do it anymore, and I haven't had to do it since. but I'm constantly reminding myself of that in real time, right? If I have, we get a lot of rough characters at Denver Health, and I'll have people who are kind of complaining, about certain patients, and not, and it's justified. They can be abusive, and and I'm also somebody of deep faith, and I say to myself in my head, Jesus in disguise, because it is a privilege to be able to take care of those people that nobody else really wants to take care of. That I can make even more of a difference for somebody that's being aggressive or disrespectful or doesn't seem to want our help, because I'm going to try, whereas I think a lot of people might not. And try to remember, and for me, what's become the biggest joy of medicine for me is getting to know people and learning their story and connecting them on a human level. I'll just give you an example. We had a guy once, he came in and he was homeless and was, really just grumpy African-American 80-year-old guy who the resident came and presented him to me and said, basically he was cold, he doesn't really have any complaints, he has some underlying diagnosis of mild dementia, but I guess we'll call social work, and maybe get him some shoes. And I said, okay. So I went in to talk to him, and I'm not the fastest person in the world in the emergency department. And this is why. I think I ended up in the room with him for an hour. I learned all about his life story, how he had grown up on this small island with 20 people on the island manning a lighthouse with his family. That was his family's work. His mom was smart enough to send him to the mainland or the United States to get educated in Florida. And he ended up getting a PhD. He became a concert pianist, traveled all over the world. I'm just fascinated. I mean, he actually introduced me to a lot of classical music that I wasn't aware of. We ended up sending him to a respite, and I visited him there multiple times. And it just totally enriched my place in this world. And I feel like, the more you exercise that, the more you can connect with people in a shorter and shorter amount of time. And so that to me is the medicine after a while is the medicine, right? And I think everybody's going to do, if they're a good doctor, they're going to do the same kind of medicine. But that I know when I first went into medicine, I thought, I just want to save one life, and then that's it. And I realize now that it's really those moments that matter. We're always so focused on the end point, right, and on the result. But there's a lot of people we can't make that end result good. Whether it's a new cancer diagnosis or they are homeless and alcoholic, but that moment matters when you're with them. It matters a lot to them. I've come to find out in talking to them that we don't have to solve everything. But just to show our humanity and that we care about them is such a big gift. And it's a gift to me as well, because I get back so much from that in my work.
Yeah. I mean,
I feel like I talked too long after your question.
No.
I mean,
You know how I interrupt Pete when that's when Pete's talking to. That's his son. So notice there was no interruption. It's not too long.
Am I cut off right now?
Really,
Yeah, like for example, now. Go ahead, Katie. If you're
but I do feel.
Is this mic working? Turn it off. Working
hours ago.
I do feel passionately about this, mostly because I think there's so many of us that are missing that experience that's so rich, and I'm so grateful for it. I don't know what I would do without it, honestly. And I think we all can get it if we can block out the noise of all the other stuff that's frustrating and just focus in that moment on the person in front of us.
Sure.
Yeah. I mean, I tend to be a bit more cynical and maybe more practical about sort of the realities that we deal with. I think Katie, by her nature, obviously you could glean, she's sort of eternally optimistic, and she derives a lot of validation and meaning from helping other people. At the same time, I think that, as a community ER physician who feels challenged by, issues of charting or maintaining throughput and patient satisfaction and, the regulatory environment. I think that, if you lose perspective on sort of the foundational aspect of the patient encounter, and, you can't derive true meaning from helping 2 or 3 people on a shift, then, medicine is not going to be a good fit for you as a career. At the same time, the reality is that I think with some mindfulness and taking an approach that, this is a person, I'm seeing them in a continuum of their life. They're clearly here for some reason, and I'm here to, at least alleviate some measure of suffering and perhaps have an opportunity to really improve their healthcare outcomes. I mean, I think that if you go in with that type of mantra and mindset, you will find that it is an immensely rewarding career in the end. I mean, we have 3 kids who grew up watching us sort of develop our careers, and the 2 oldest ones have a demonstrated interest in medicine and actually emergency medicine. And I think that speaks volumes to the fact that, even 20 years out, with, me being a community doctor that goes into basically the same setting every single day, and, the job has changed in many ways for the positive, but also many things that are negative. But yet I can still derive that immense satisfaction from the that isolated encounter and helping several people every single day that I show up, which, when you compare that to other vocations, I mean, I think that, in economics, they talk about, opportunity costs. What else would you be doing with your time and efforts? I mean, I think that there is, foundationally no more noble profession. And, I think that just the fact that this next generation of kids sees it as that is, I think, a reflection of, really what the profession could represent at its best.
And I really think it's a millennial profession, honestly, in a lot of ways, because we have our finger on the pulse of what's happening in our community way before we know flu's hitting before we see it in the news.
Absolutely.
We know there's an uptick of violence. We know there's a problem with homelessness, substance abuse, the opioid epidemic. We're like, yeah, there's an opioid epidemic.
See it every day.
Like, hello. And so I think it really fits well for people who are also socially minded and want to be involved in almost social emergency medicine, right? Where they can not only have that inside view, but be a really effective advocate, because you can speak with authority and credibility about what you're seeing every day come in. And so I didn't realize, I went into emergency medicine because Peter was going into emergency medicine, honestly. I didn't know what I was going to do. And he was like, I'm doing emergency medicine. You should do emergency medicine. And Ron Walls, who was my mentor at the time, was like, you should do emergency. I was like, okay, I'm going to do emergency medicine. And, I believe I have a little guardian angel on my shoulder, which got Pete to me and got me into emergency medicine, because it really does, it ended up exactly what I should be doing, because I do gravitate to that social emergency medicine side of things. And there's very few professions like that where you can really have that authentic voice and be heard.
One thing I hear a lot from you, and when my wife Ryan, came over for dinner, we talked about meaning and how, and I've heard it come up just in the last couple of talking points that you both have made, and you both have it's my impression that you both come to a sense of meaning in your professional and personal lives. And then we've talked about how you foster that in your kids. And it sounds like they, to some component, find meaning in medicine and in the job. But how have you fostered that in them? You found it yourselves. It's been an intentional, kind of mindful journey for you to find that, and you've reached that in your personal and professional lives. But how have you fostered that in your kids based on your common shared values?
So
Okay, first of all, I have to say one thing. Pete does this thing where he'll have like a night where we're going to talk about homelessness, right? And then watch Seattle is Dying, and then have an intellectual discussion about it afterward. Sometimes it's about a country, and then go to dinner for at a restaurant that's that country.
Really?
Yeah. So
and then we'll study the socioeconomics, and then there'll be some.
That's amazing.
he's
Tell me more about that.
He's like a
Open-ended questions.
constant teacher. I always tell him he should have gone into academics because he's such a natural teacher. But
I mean, I think we can talk about the specifics there, but sort of looking at it from a higher level, I think that when Katie was first pregnant, I felt like the responsibility of becoming a parent was a bit overwhelming, and so
you
true to
started clubbing?
form.
Actually, he did.
This is the jail.
He
This is
started
the jail
clubbing.
story. This is how it begins.
Jail comes later. He literally started clubbing when I got pregnant. I was like 8 months pregnant, and I'd come home from my shift, and he's like, "Yeah, I'm going clubbing with the boys." And he would have these like shirts that were these shiny shirts.
Pete has a
that were
Jersey
the button
background.
down.
Jersey background.
I
True
adapt to
story.
my environment.
True story.
I adapt to my
I'm
environment.
like, "Go on, honey, go have fun."
Yeah, put on
I'm
another
gonna
chain,
rest.
Pete. Yeah, it looks great.
Back in the day, I could rock the feather bow and the Elvis glasses. Right now, I think people look at me funny. But back then,
It lasted like
People,
3
namely
months.
your daughters.
I
But
could pull off sequins. So anyway, so there were some times when like I wasn't especially focused on preparing for parenting, like the LA club scene for like 6 to 9 months. But I remember reading a book on parenting, and what I took away from it is that you teach your kids values, you teach your kids life skills, you foster their self-esteem, which I've translated into the notion of self-efficacy, and then that translates into a passion for life. And I think that those things are really difficult to sort of do in sort of a structured manner. And what I've tried to do is just live by example. And I think Katie does that immeasurably well. I mean, ultimately, and this has been my experience with my kids growing up, is they see through hypocrisy. And if you're not coming home from work and talking about sort of the positives about the benefits of helping other people, and they have all of these other external influences where their meaning could come from money or power or some sort of stature. If they're not seeing that meaning comes from a more holistic perspective on your role, from you, the way you live your life every day, then I think it's never going to translate to them. And I mean, I think that anyone who's been a parent would identify with that. You can't do it through curated experience. And I do stuff like that because because I think that especially in our setting with our socioeconomics, if you don't have sort of a diversity of experience, then you don't have a perspective on how much other people struggle, and the fact that the world has spreads equal talents, but it doesn't spread equal opportunity. And I think that if you don't if you don't expose your kids to that, then they don't get that perspective. And I mean, a lot of that comes, I think, from my upbringing, but it's certainly been something that has been potentiated by Katie's worldview.
Pete, you're a first-generation American. Tell me about how that has shaped you. And it's starting to already come out in your answers, but tell me.
Sure.
You've clearly thought about that.
Yeah. I mean, I think that I didn't think about it growing up, but in retrospect, I think it proves foundational. I think so. Just so I can give you sort of the framework, my parents were professors at university in Bratislava, which is now the capital of Slovakia, and it was the late 60s. Obviously that was Czechoslovakia at that time was an Eastern Bloc country under sort of Soviet rule with a basically a puppet government. In Czechoslovakia, there were some overtures on democracy. And then in sort of a sentinel event called the Prague Spring in 1968, Russian tanks came into the capital of Prague. Famously, there was a person who set themselves on fire. It was much...
Unbearable Lightness of Being. Think of that.
Yeah.
That was the movie.
And my parents, and especially my dad, who was someone who was always idealized America and its freedoms, found, told my mom that, I can't raise my kids in this type of environment. And so what he did was, he said that, he would try and escape as a political refugee. And because of sort of circumstances, they didn't have any family in anywhere else in the world. All my family, and to this day, everyone is still in either the Czech Republic or the Slovak Republic. But my dad emigrated as a political refugee and settled. His first place was in Harlem. And he got a job as sort of a grunt engineer, made enough money, and then sort of was able to communicate with my mom that she should try and escape as well. Wow. And my mom, they had already had my oldest sister, Sue, at the time. So she was 8. My mom, at that time was potentially going for a PhD. So one of the few women engineers in that whole country that was going to be a PhD candidate at that time. And they gave her an opportunity to go across the border to Vienna, which is right across from Bratislava, and with her child, which was sort of an extraordinary circumstance. And so they were in a refugee camp there for several months until they were able to get entry into the United States, and then they joined my dad, and then soon after moved to Queens. So that's where I was born. Just a year and a half later, my sister was born in between. So they had 3 young kids living sort of a gritty life. My mom barely spoke the language. Here she was, someone who was highly accomplished, had stature, certainly in her sort of local society, and she had the most menial job that an engineering firm could have, which is just doing the drawings. So she couldn't practice to her degree. Someone took her in and offered her that, basically minimum wage. And so fast forward a little bit, my sister is struggling in that environment in the New York public school system. My parents are struggling financially, 2 parents both working, kids going to daycare during the day. But my mom knew that, it would not end up well if my oldest sister was still in that environment with the negative influences, and it was really starting to impact her in a fundamental way. So she basically said that we have to move to a place where they have at least a good school system. And so we moved to northern Jersey, which is where I grew up from age 5 to 18. And I would say that, immigrants, I think, succeed for a variety of reasons. But retrospectively, when I think about it, the things that motivated me were that, on the one hand, there was a profound sense of instability, financial, social, not a lot of cultural supports, no family to rely on. So there was that instability and uncertainty, and the pathway out, as it were, was to get an education. And on the flip side, there was a sense of, I think, potency and ability, knowing that my parents were these literally highly successful, like at the top of academia in their country. So I knew, at least within me, that potential existed. So I would say that the dichotomy of, profound instability in your environment and a true sense of sort of personal accountability in terms of the opportunity that was given to you. I think that, those types of things, I mean, if you look at like Indian Americans of our generation now, I think that is, and then before that, I think Southeast Asian Americans. I mean, I think it just sort of plays itself in that, you have these kids that are growing up in households where they see their parents, working their fingers to the bone. So they get this sense, they get the work ethic, but yet they see their family struggle financially, and, in other ways, all the things that come with that, with financial insecurity. And I think it ultimately just sort of translates into, diligence, hard work, and then delayed gratification, this understanding that, you have to work hard for the future. And what I think it's translated for me is, I think on the one hand, a profound sense that, opportunities are not equivalent, right? I mean, my sister, who grew up in the same household, never went to college. There was a period of time when she struggled with, not just only her academics, but, there was a period of time when she ran away from home at 16. There was an early pregnancy. There were some other things that you could sort of surmise. And yet here I am just several years later, growing up in a comfortable sort of lower middle class or middle class environment with a good academic system. And I feel like all of that opportunity was there for me.
Yeah. And would you be the same if it hadn't been for your older sister?
Oh, I definitely don't think so. I mean, I think that, that it gives you a real sense that, you can't take that opportunity for granted, right? And then, where I grew up in northern Jersey, I mean, that was another sort of, I would say, extraordinary little microcosm of what the world should be like. I mean, the reality was on my street was a cul-de-sac, and every single family on the cul-de-sac was first-generation Americans.
Wow.
There was Orthodox Jews next to a Dutch and German immigrant, next to us, next to a Taiwanese immigrant, next to a Colombian immigrant.
Puerto Rico.
Puerto Ricans next to them. Next to them were Pakistani. Next to them were Greek immigrants. Loud. And then
I plead the fifth.
and then as if on cue, there was the end house, which was the only pool, which is an above ground pool where all of the kids would hang out with, was like a fiesta every weekend because it was a gay Puerto Rican couple. Yeah, I mean, right? You could not script that.
No.
And here
the
you had
American
this sense
dream
of here you had this sense of all of these people coming here for opportunity, and then then they would go into this good public school system where they got exposed to our town was, I would say, the least affluent. The other three towns, some of the most affluent towns in northern Jersey. So I would say that the juxtaposition of you had a bunch of sort of smart kids from lower middle class, and now they were exposed to a bunch of really affluent kids that you sort of learned some of the soft skills. Yeah.
This is where Pete gets his edge.
There's a theme. I did have a nice VCR back then.
He stole stuff.
So I mean, I would say that it was just sort of this environment that fostered personal accountability, but also sort of a profound understanding that the environment that you grow up in makes a big impact on the opportunities that you get. And I mean, that to me animates a lot of the things that motivate me now.
Yeah. How do you almost manufacture that in a way to your kids? I mean, it would be great to, in actuality, living in a community like that, but in the absence of being able to do so,
you have a night where you have Pakistan night, and then you go go to dinner at
Yeah.
a Pakistan.
Bollywood movies are incredible.
Bollywood movies. Oh my God. Watch Jab We Met. Anybody out there? It's totally. Every time somebody's complaining, I'm like, Jab We Met. Just watch Jab We Met.
I got some incredible dance moves from
Yeah.
that.
Yeah.
A little dilly dilly dong.
The other thing I would say is,
I had to step away from the mic to laugh.
go pleased with himself.
Yeah.
he
Part
is.
2 of this is a video podcast. I host this podcast because I have a face made for radio, but we'll put Pete on. We'll put on some supplementary video.
He's being extremely humble. This guy must loofah twice a day. His skin
He
is
does
impeccable.
have good skin. He
Like-
has and teeth. Good teeth.
Good teeth. Yeah, good stock. You gonna kick him in the calves now? This guy's.
Maybe.
Check his lower lip. No, Ryan's doing well.
I married up. Pete knows the feeling.
We know the move.
We know the
But
move.
we also, I mean, I've also had, and Pete too, have integrated them into things that I do with the programs that I oversee. And I think that's really also given them a lot of perspective on things coming into that.
Yeah. So, I mean, another quote, which
Off the cuff, no
which I want
scripts.
to do,
I'm here.
which
True story. He's not reading this.
Checking my laminated sheet. It was definitely one of the founding fathers. I think it was John Adams. He talked about being like a political statesman and a lawmaker so that his kids could have liberty. And then he said, with that liberty, my kids can study, mathematics and the sciences. And then with that sort of stability, that his grandkids could study things like poetry and art. And I think that's sort of a little bit of the American dream, right? I mean, you had my dad who found it insufferable to raise his kids in a country that did not have liberty, picks up, whole family comes here for that opportunity. I perceive the fact that opportunity is like no other place in the world, in human history, and I work really hard to create some stability. And then, I think we project to our kids that, with that liberty and with that, stability, with, a loving family, social, and maybe a safety net in terms of financial support, they have to go out there and take the opportunities that were given to them and, advance that cause. And I mean, I think that, in this day and age of polarized politics, especially with regards to immigration policy, I think that people should take a step back and really understand no one is really more American than immigrants, right?
Yeah, I mean, I agree. And I always say, I wonder what God put me on this earth for. And, now I know it's to make them, right? They're going to pay it forward.
Katie, your faith is powerful. I know it's an important part of your guys' family. And how have you both seen your faith and or spiritual journey grow concurrently with your professional practice? I mean, personally speaking, I think there are very few venues, potentially excluding, the actual priesthood or, directly related to fostering someone's spiritual growth. But there's very few venues where I can imagine there's a more spiritual experience than being in the emergency department in terms of meeting people at their point of being most vulnerable, potentially that they've ever been. Meeting people, you talk about themes of suffering or pain or true joy or relief, and those things exist on a magnified scale in our day-to-day practice, more so than potentially anywhere else. And how has that interacted and molded your faith and your spiritual lives, and then in turn, because I know that in turn trickles down to your family, how have you seen that take shape? It's a light question. It's very very easy.
I like empathy. I think that's something you exercise, right? And so I always say, God's all around us. We just don't always recognize it. And there are those moments, and a lot of times there are moments in the emergency department where something happens and it just feels like it's bigger than coincidence. We had a woman who came. She was traveling through Denver on a bus across country. She started to get belly pain. She was developmentally delayed pretty significantly. Ended up, she was in labor. And I was working on the pediatric side, got called over because to resuscitate the baby. She didn't even know she was pregnant. And this, beautiful, we didn't know how many weeks she was, nothing, right? She was crowning and it was happening. And this beautiful little girl comes out and basically I just dried her. It wasn't a lot of work.
Shook some hands.
Exactly.
Signed some autographs.
I did it.
Smoking cigars.
Walked in.
Yeah.
Let's have some scotch.
Yeah.
And we had one of our nurse educators on the pediatric side had been trying to have a baby for a long time and got on the foster to adopt list, and called me the next day and said, "You know that baby you delivered yesterday?" I said, "Well, I don't know if I'd really claim that, but okay." Yeah, I was there. She said, "I'm her new mom," and she was the next person on the list.
Wow.
And got Maddie now, who God, she's got to be 10 by now, and it's just, I think you have to savor those moments and recognize them and acknowledge them, and they're all around us. Honestly, I mean, every time a patient hugs me and says just thank you, I see God in that, and I think. I do believe God is love, and so the more, I think the more we look and the more we see it, it certainly builds my faith, and I get so much back from that, and I think it starts to feed on itself too. Mm-hmm. So if anything, it confirms my faith, and even during tragedy, I think there are things that we can do that, I had a patient the other day who we admitted who. Had end-stage cancer, and just being able to talk to the family and get them to the place where they felt okay making her DNR, and the gratefulness around that, and trying to help them deal with their emotions. One of the men, really loving family, had to keep stepping out because he was clearly going to cry. And I said, and there were other younger guys in the room and boys, and I said, you got to feel it. And he goes, "How do I do that?" And I said, the first step is not leaving the room, because they have to see that it's okay to feel that too. And he did. He kind of let it out. And it was this really beautiful moment, even in the setting of something super sad, that, all of us sort of recognized that God was in the room. And it wasn't me who said it that time. But I find the presence of God all the time when I'm working. Does that answer your question?
It does. It does. Powerfully.
Yeah. I tend to be a bit more rational or a bit more skeptical. I think I'm
very rational. I'm also, I don't think it's not being rational.
I think that's accurate. I would just sort of look at it from a perspective that, many of the sort of great religions of history, be it Hinduism or Confucianism or Islam or Christianity or Judaism. The values that they represent are universal human values and moral values. And, whether or not you do it through the vessel of organized religion and whatever type of scripture you use as a foundation of that, the reality is that if you study sort of the universal tenets of all of those things, that it's really, whether it I would say foundationally creates good people. Mm-hmm. And I think that if we view sort of what binds us together, and I don't want to sound Pollyanna or naive, I work in the trenches for sure, and I'm generally very reality-based, but I think that, thinking about it from that idealistic perspective is really something that, allows you to sort of be tolerant to other people and their perspectives, and meeting them where they're at. And, I think it creates a certain idealism that's necessary in a world where it's easy to become cynical about human nature.
Yeah.
It's protective.
Yeah.
Yeah. And it,
And I mean, look, what's the alternative in that regard, right?
Pascal's wager, right? What do you have to lose?
Mm-hmm.
Right?
Yeah. You have a lot to win. I mean, Jesus is my guy, but I love him. But I do believe that God is smarter than we are, and he manifests in lots of different ways, and that all of those religions, they have that commonality for a reason. It's not by accident.
Mm-hmm.
And that God knows how we're going to connect with him based on our background and culture and, place on this earth.
Right. At a point in time. I'm going to push it one step further, which is to say, people challenge me or ask me, well, what is the purpose in suffering? We see suffering of the highest order, and for patients, for their families, for us, for our staff, there's suffering, and it's every shift. And I don't know that I have an answer to that, but I have my thoughts. But how do you?
What are your thoughts? I'm taking over now.
No, it's my thoughts are, we each found ourselves where we are because of an infinite number of small events and influences and people who have sacrificed for us and committed to us and guided us intentionally and unintentionally to where we are. And I think that we each bring a diversity of experience, and the purpose of interacting with people in their moment of suffering, to me, is to reinforce our common humanity, and to say that it doesn't matter in the emergency department where you came from before you came in the ambulance bay door. And
none of us get off this earth alive.
Right. And one room to the next, you can cross the entire social, economic, racial, ethnic, any spectrum that you can imagine, from room to room to room. And there is a shared commonality in the human experience of suffering and pain.
Yeah.
And joy and truth and goodness and things that are genuinely to be aspired to. But I think that the purpose of suffering is to remind us of our common humanity, and to foster in us a sense of taking care of one another. That's my personal interpretation, but you guys are much more articulate than I am, and I ask the questions around here, so I'll be doing the questions from now on.
I totally agree with what you're saying. I think the way I look at it is very similarly. I think suffering brings grace, and there's a reason why when many people do get a really horrible diagnosis, they seek God. Or when we're struggling, we think about our spirituality. And so there's a purpose for it. And I think it does draw us closer to each other, and therefore closer to God, because God is happy when we're closer to each other and we're caring for each other. I also believe that, from God's perspective, and don't pretend to know what God thinks, but this is the way I've compartmentalized it, that, this world is a drop in the bucket of eternity. And so, yes, he allows things to happen that create suffering, which do bring us closer to him. But in the grand scheme of eternity, he's saying, don't worry, I got you.
Yeah, I mean, I think that's beautiful.
It's going to be more logical.
Well, yeah, I mean, from my perspective, it's just, suffering's the reality. Mm-hmm. And the question is how we respond to it. And I think that if we look at it as, the Buddhist tenet is embrace adversity, right? And I think that if you want to take it from a religious perspective, there's definitely sort of parables, but just from a evolutionary anthropology perspective, the reality is that if we're pushing at the cusp of progress, then inevitably there's going to be gains and there's going to be losses, and with that, people are going to suffer. And I think that, I'm speaking more of sort of challenges and failures and dealing with anxiety for people trying to accomplish things. I mean, from a medical perspective, I don't think that there's, there's no real value to suffering. But I mean, if it exists as a reality, then I think it's a noble vocation to try and alleviate that.
So I think your guys' complementary relationship with an I and an E, but focusing on the complementary part of it, I think you have found your practice environments that suit you, right? I mean, and I think to what extent was that an intentional decision coming out of training? To what extent did you have maybe a mentor that told you, Pete, you're suited for a community hospital, or Katie, you're a great teacher.
Yeah,
you should go into academics.
It was actually more
Pete,
the other way around.
Pete,
honestly.
you should just get any job you can. I'm speaking hypotheticals here, but I think that decision is one that is ubiquitous amongst our listeners, I would imagine, and is among the hardest ones we make over the course of our career. And any insights you guys have about how you made that initial decision and how that's been kind of validated over the years, I think would be really helpful.
Yeah, you want to start?
Why don't you start?
Okay. I mean, from my perspective, making a choice of sort of an academic route versus a community route, I would say a significant portion of it was sort of the lifestyle, the ability to have sort of a set schedule that would allow us to balance family was really important to me. That was a big part of the decision to do emergency medicine as well, certainly for me. There was a financial difference as well. So just sort of thinking practically, I mean, there was at that time, probably a 50% difference in terms of compensation. And then, a lot of it stemmed from, I think my desire for stability, whether or not it be stability of schedule, the financial stability it afforded. I mean, to me, it was really unnerving to grow up in a household where there was constant struggle over finances. And I saw how much of a toll it took on my parents and how it impacted their happiness and how that translated to sort of, the way they interacted with their kids at times. I mean, I was really drawn to the stability of community medicine. At the same time, I feel like I'm a very curious person. I mean, like a lot of us who do medicine, and I think specifically emergency medicine, sort of the diversity of disciplines, even within emergency medicine. And, I think it would be, there was a potential intellectual upside in terms of doing academic emergency medicine, but I didn't have a, passionate academic pursuit at the time. I had sort of dabbled a bit. I'd taken some coursework at UCLA Extension School in medical informatics. So I sort of had my eye on technological solutions to healthcare problems, but it wasn't enough of a draw. I think it was, a lot of it was sort of the stability, which I think stemmed from my upbringing.
Yeah, I don't think about things as much as he does. I'm more of a gut person. And for me, I think I just thought in my head that I wanted to be at a county type of hospital, that took care of a lot of indigent care, and that tends to cohort with teaching centers.
Right.
I love teaching and I love my residents, but it was really more the patient population that I was drawn to.
And Katie was validated a lot in terms of sort of, handpicked as sort of someone who would be thrive in an academic environment in a way that I wasn't. I think that, she was selected as chief resident. She won the med school emergency medicine award, which was obviously given by academics there. So, I think people saw her intellectual prowess, and then they knew that with her passion, that would translate into sort of a meaningful academic career.
And with her, as always, was Pete.
The award-winning Dr. Bakes. So that reminds me of
You should tell. Please do. Please tell our listeners the background of that story.
So from about 2000, let's say 7 to 2013, it was a pretty dark time in the Bakes household. This was a time.
Fellowship in pediatric emergency medicine.
Oh no, this was after that.
Oh,
this was
after
after
that.
that.
Sorry.
This is the award-winning Dr. Bakes.
Oh,
So not only was she award-winning in medical school and residency, but the hit list rolls on. So sometime around like 2006 or 7, when the kids were just getting cognitive at like 5 or 6, on the nightstand there'd be the 5280 magazine with Denver's top doctors, right? And they'd be sort of thumbing through that, and they're like, "Oh, here's mommy." And then they'd look down a little further, and they'd be like,
"Wait, they have the same last name. There's only
where's
one.
Daddy? He should be right next to mommy." So
this is about the same time when Pete got arrested.
she got 52. She got 5280 top doc, something like 3 years in a row. She also got Denver Business Journal puts out a 40 under 40. Mm-hmm. So between the nightstand and the various award ceremonies, the
red carpet
it
galas.
Started to
it's a lot.
Yeah.
He's exaggerating.
So they knew it was irking me a little bit. So they started calling her the award-winning Dr. Bakes, and me like Pete or you. So that was like 7 years, and then I got like a little bit like butthurt. So I'd bring home like these thank you notes from nurses that are super sweet, but it was like, "Hey Pete, I liked working with you on shift, Amanda," and then I'd show them, and even as like precognitive 5-year-olds, they would sort of. My oldest kid would just, she was always like want to, make me happy. So she'd be like, that's great, Dad, in like a broken voice. And then my more skeptical middle kid would just sort of look at me with like a frowned face, like, "Dude, bro, you're trying too hard. It's not a good look." So that was until like 2013 or something.
I don't think Katie stopped winning awards. I mean,
yeah, right. I have to break out like my soccer trophy from like 8th grade.
You won the championship, baby.
North Jersey,
right?
3rd place.
We took them.
Yep. The fighting.
Did Pasquale's deli. Yeah. So that's my lot in life, though.
It's a tough road you've chosen. A rewarding but tough road. Yeah. Let's talk about what keeps you guys busy out of the hospital. We touched early on, kind of some of your extra clinical pursuits, and just kind of tell me what gives you passion outside of taking care of patients, and how that's grown over the years. Pete, you can start.
Yeah, this will be short. We'll come back for part 2 of the podcast here in just a few minutes, and Katie can spend the last hour and a half talking about her pursuits. So I would say for me, aside from sort of just trying to be present in the moment for my kids and doing my clinical shifts, I'm involved in 2 projects, sort of longitudinally. One is a pipeline program that we started at Nate, actually, who's our sound guy, was pivotal for that first year, and now we're entering our 3rd year. And basically, the way it's structured is it's work-based learning for kids that are underserved population. So we work with a high school here in Denver, and the first semester we have about 30 kids. Second semester we have a more intensive experience for 6 kids. And they get a medical curriculum to go through their coursework. Their teacher teaches a course called Biomedical Sciences, and the concept is that they get some, foundational knowledge that then they'll implement in sort of a work-based environment. So I would say it's somewhere in between, like actually vocational training for a specific skill and sort of the abstracted, either liberal arts or STEM curriculum that you see in other high schools that are their peers. And with that background, then they come and they do a bunch of shadowing shifts with providers at all different levels of the hospital, be it doctors, PAs, nurses, respiratory therapists, radiology techs, just so they can glean, sort of the landscape of the hospital ecosystem and the different roles that are available. And the fact is that, many of these kids don't have the opportunity to go to, a 4-year private institution with the attendant costs. But on the flip side, they can get college credits during their coursework. They get a sense of, what the medical profession really entails. And I think it animates their passion for working harder in school, and it gives them a pathway to those careers. And what we've seen this next year, or this last year, is that, of the 6 students, 3 or 4 of them are going on to medical careers. And the feedback we've gotten was that, it really opened their eyes to the fact that, there's a lot of really substantial work that's meaningful, that is good middle-class paying jobs for kids from their backgrounds. And, it's that whole trajectory that we want for, these disadvantaged kids largely come from households that don't speak English, where their parents emigrated, and they've been given this sort of opportunity, but they haven't had some of the sort of soft skills of, mentoring and networking, and really didn't see themselves in sort of middle class or upper middle class socioeconomic strata. And I mean, that's what we're intending to do. So technically, what we're career coaches for the Denver Public School, and under a grant from the Department of Education called Youth Career Connect, which tries to pair kids into jobs in the community that have a sort of demonstrated need. And what we are is sort of a liaison between the public school system and those private sector jobs.
How'd you get into it?
So it was a relationship that Katie fostered. I mean, Katie's involved in a ton of these different programs, and, David is a public school teacher that teaches this course and at CEC, Early College. And, she thought I'd hit
Big
it.
Mac, shout out.
Big Mac.
Shout them out.
Yeah. So yeah, that's how I got into it. And I mean, obviously you've sort of gleaned from what we've talked about. I mean, it's a lot of the things that from my upbringing that resonate, right? You have these kids where there's definite talent and potential, and they just need to be put in an environment where they have a sense that this world is for them, right? And I mean, we focus on professionalism and personal accountability, and in a lot of ways, they have to work harder to take advantage of those opportunities. But on the flip side, the adversity they suffer should give them sort of strength and a sense of personal efficacy and, conviction. So, I mean, to me, that's sort of what as mentors for people in those types of communities, we should be potentiating, which is we're going to create those opportunities, and you need to take advantage of them. And we're going to be here to mentor you, and hopefully down the road to help network a lot of the things that kids from other socioeconomic strata sort of benefit from, either explicitly or implicitly.
Sure.
But ultimately, if it just sort of resonates with this notion that we're a country that's a meritocracy, and people should have an equal opportunity to achieve.
Our specialties in our community are destined to benefit from that. That's great work.
Yeah,
that's really neat.
Yeah.
Thanks, Pete, and thanks, Katie, for really getting it started. It sounds like it was your connection that got it off the ground. In a shock to no one,
He
but
took off.
Yeah. And then the other thing I'm involved with, which is actually sort of getting rebooted now, is a company called R Explainer. And so this sort of appeals to my sort of entrepreneurial, specifically with regards to tech solutions in healthcare. And basically, me and Dylan and Chris, who are two
Dylan
of our
Lloyden,
partners here.
Chris Holmes, shout out.
Respect.
Respect.
You
So
can't pull that
the
off.
three of us for the last several years, have been working on sort of a web app that facilitates communication between providers like doctors and nurses with patients to help them navigate their care. I mean, our use case is in the emergency room, and it's specifically geared towards the pediatric emergency room. But, an example of it would be, an anxious kid coming into the pediatric ER, and they're going to get an IV, and, obviously that's a highly stressful situation for parent and child. And basically we have sort of a suite of videos, including a pediatric IV start video. So it's under this category of child life, which is, giving kids imagery and language that they can relate to help alleviate their stress. So basically, we do a simulated IV start in a child their age, and the child is interacting on camera, not reciprocally, but talking to the camera as if they're talking to the patient. And, it makes a big difference, I think, in terms of helping kids through this stressful time. I mean, ultimately down the road, our notion is that great healthcare is great communication, and, shared decision-making with patients on resource utilization, helping them understand the risk, benefits, and alternatives of TPA and stroke, discharge instructions. All of those things are, I think, amenable to being delivered cost-effectively, time-effectively, to patients on this type of technological platform. I see your eyes are glazing over there, Nick.
They're not glazing over. It's not true. That's
He
not
worked
true.
last night. That's probably why. He's tired.
Yeah.
No, it's fascinating, and I think it's the next
put your head
frontier.
down?
You take over. You take over.
I was waiting for this opportunity.
I'm expendable
I asked
in
the
this
questions around
podcast.
here. All right, so Katie.
No, Pete, it is interesting. I mean, I think it's the next frontier of our practice, right? I mean, I think being able to communicate by means that are knowable to the next generation of folks. I mean, I think that so much of what we do to explain things to people and to participate in that process of shared decision making with them is outdated, and there's just such a gap between in terms of numerical literacy or numeracy.
Yeah.
I don't know, is that a word? Numeracy.
I'm nodding yes.
It is.
Sure.
It is now. Or and just like you said, risk benefit of the innumerable number of tests we can order, and I think displaying that in a way that's understandable is.
Yeah, and I mean, the concept is to, give a framework for the patient to understand it in, language that resonates with them. And then the physician or nurse comes in for a higher yield encounter where they say, okay, well, in your particular case, this is what we see. Mm-hmm. So, instead of sort of them trying to comprehend what the term TIA is, they already have sort of a graphic representation of what it represents. They've had a chance to, view a several-minute video, and they have sort of a framework for having that sort of higher level discussion, which, I think it benefits patients in terms of, allowing them to make decisions that are consistent with their values and preferences. And it also goes a long way towards, mitigating defensive medicine for physicians, where, they can practice more cost effectively with the patient and franchise in that process.
Thank you. Coming to an ER near you.
So, someday someone will succeed at that.
Katie, you're up next.
So I I think I told you I'm kind of a gut person. So I think when I see something that needs to be done, that tends to be what I gravitate towards. So when I first got to Denver Health, and I think a lot of people who are starting their career think about this, like what do I want to do with my career? And I'm not somebody who goes, oh, okay, this is where I want to be in 10 years. That's not who I am. Right where I am at this moment, what is it that I see that needs help? And so when I first got to Denver Health, started ACEs, which is Art, Chaos, Ethics, and Science in Medicine, for the residents to talk about what it means to be a doctor outside of just taking care of patients. And that was really meaningful to me, and because I felt like it was something that was needed and that was received in the way I had hoped. That people said, yeah, we need more of this in our residency.
They'd always
experience.
meet in our basement and leave the toilet seat up, and there'd be red wine stains. So
But
it wasn't.
What happens
It
at
wasn't all
ACEs
high and noble.
What happens at ACEs
Exactly.
stays at ACEs.
Exactly.
But we had some cool stuff,
Raucous.
like
Sordid affair, that ACEs.
Peter Rosen came a couple times to our house to talk with the residents, and we talk about what is it like taking care of patients who are aggressive or abusive, or substance abuse stuff, dealing with death. What is it? What does it mean when you don't like your patient? And things that we don't talk about very often. And it was a safe space to be able to talk about that. And
No microaggressions there.
and then started the SANE program at Denver Health. Around that time, also heard that Children's was going to be moving. So went to my CEO at the time, Patty Gabbo, who I'm super grateful for as a mentor, because I said, I think we need to start a pediatric emergency department at Denver Health, because Children's is moving, and at that time we were sending all our sick kids over there after stabilizing them, and they were mixed with adults. I remember this one moment when a 3-year-old and his parents were next to a guy in an orange jumpsuit that was cursing and rattling his cuffs on the gurney, and started peeing on the floor right next to this 3-year-old. And I thought, God, we really could use a pediatric
This
ED.
is suboptimal.
Yeah. Now, the 3-year-old loved it.
He was like,
loved it.
"See?
He thought it was so
It's
great.
not a big deal.
Right. Mom is so judgy.
Parents,
God.
not so much.
This guy seems to be
The
thriving.
potty training
seems
and
to
the
be
potty
thriving.
training.
I know.
He doesn't
Enough
use
with
the
that.
toilet.
Enough with that.
And so went to her, and she was great in supporting me to go and do a fellowship and come back and work with a team to set up the pediatric emergency department. And then when I got in that role, I was medical director there for 5 years. Started to become more conscious of the problems we were having with youth violence in the community and gang-related violence, and sort of got involved with GRASP, the Gang Rescue and Support Project, the community grassroots organization. It's been around for 35 years, I think. And so decided I really needed to hand off my work being medical director of the PEDS ED, because I wanted to focus on this now. And after that, started AIM, At-Risk Intervention and Mentoring, which is our hospital-based violence intervention program. So, I would say the things that, yes, I was responding to things I saw, but it was also what I needed, right? And made, I think I wouldn't be able to do emergency medicine anymore if I didn't have that latitude. And I'm super grateful for folks like Dr. Gabbo and Phil Mailer, who was our chief clinical officer at Denver Health for a while, who really supported me and said, yeah, you can do this stuff. And I think that's unique to Denver too. It's kind of cool, right? We're not entrenched in sort of an ivory tower type of place where you have to stay in your lane, but you have a lot of opportunity, and I'm really grateful for that. So started to get involved with the hospital-based violence intervention program. It initially started with just sort of calling in some of the guys I had met from GRASP to say, I think this kid could really use, somebody like you to come and talk to them. To what it's become today, we have 6 outreach workers. We have a mental health navigator as well, and they meet patients at the bedside in the emergency department, also in the community or in our clinics, because people call them for lots of now that they know about us. We've served over 900 youth so far this year. And they help a patient. Our sort of focus population is 14 to 28. If they're shot, stabbed, or assaulted and they come into the emergency department, one of our outreach workers goes to the bedside and helps them navigate their visit, helps them kind of translate the cultural language between where they're coming from and then our staff, and then start to talk to them about their lives and get to know them, and then ultimately case manage and mentor them after they leave the hospital to help close gaps to prevent them from having violent recidivism injuries.
Break the cycle.
Yeah, break the cycle. And we're part of a national network called the Hobby, which is amazing, on the board, which is a huge, they're just an amazing group, honestly. Doing, research around that, doing, program building. We've gotten some really great grants through the Department of Justice, some philanthropic support, and that got me to start to think about what can we do, not just to meet them in that moment of crisis, but also reach out to kids in the community to prevent them from even getting to that point. And so started to think about working with kids in high schools. And started out just doing sort of internships in the summertime, doing some career day exposure for kids. We did about 400 kids that came through for half-day exposures. And then
as I hear you talk about this, have you been on a lunar mission or no?
Not yet.
I assume the CV will be in the show notes.
It will be. It will be. Well, the file is pretty big. We might not be able to be uploaded.
It just says,
do they
it
do
just says
microfilm?
award-winning
They still do
Katie Bakes.
microfilm? Yeah. Yeah.
But I tend to think about like the why behind things, right? And so to me, doing this pipeline work really does serve a lot of those whys. It certainly does all the things Pete talked about, but it also, when I look at the work with AIM and our hospital-based violence intervention program, there's such big cultural gaps in our communities in terms of lived experience. And something as simple as telling somebody to follow up with orthopedics, on this day can be impossible for many people who are, if they can't miss a day of work because they'll lose their job, they're living paycheck to paycheck, they don't have insurance, they may not have transportation, they may not speak the language, right? And just really trying to understand how can I be part of like a cog in the wheel to change the system so that the folks who are in the system understand those lived experiences and design the system in a way that is actually workable for the people we're serving. And it's a lot harder to teach that than it is to infiltrate with those community members,
Right.
so that we are reflecting as a medical community the people we're serving more. And so, yes, it gives me a huge amount of personal satisfaction to have these connections with these students, but it also, my hope is that it will fundamentally change our healthcare system, particularly in communities where there are those big cultural gaps of understanding. And you figured out now I'm a God person. So I was reading a People article magazine once, and I saw an article on Faces for the Future out of Oakland, California. And I said to myself, I don't know why, but I know God wants me to have this. And so I tore it out and I scanned it, and I never do that, like ever, ever, ever. And I started getting involved with these internships.
So Katie obviously responds a lot to sort of God's input. I also have to text her periodically, but dinner is at 6. So if God is not
too busy tonight,
not too busy doing God's work,
if he could put his work off till 8,
and we only have 2 of our 3 kids accounted for, which to which she responds like, that's basically 70%, and in the community she serves, 70%. is a great result for a lot of things.
So anyway, where was I?
Faces for the
Oh
future.
yeah.
Yep.
So
And what you
I had
did
been
with
doing
them.
these internships, and what I found was that the students afterward, many of whom I still work with from our first internship, actually they've come on to help teach some of our kids now. Are they kept wanting to do stuff, right? And they'd be like, "Okay, Dr. Bakes, now what?" When the internship was over, and I said, "Nothing, no more. You go away from me.
Yeah.
I am not. Now it's on you." And they wouldn't go away.
Go forth.
Yeah. You don't have to go home, but you can't stay here.
And I realized, that the 1 month or 6-week internships that we were putting on were just too short, right? And we needed more of a longitudinal experience with these students to really have an impact and have.
So the kids moved into our house.
So
Not far from the truth.
Stay tuned. That's the next thing.
yeah.
I'm like, who's this guy Victor, and why doesn't he ever put down the toilet seat?
But and so I was asked actually with David Mack, the teacher at CEC, if we would run a summit for Career Connect for their program, and they gave me this list of here's how we're going to do it, and we're going to have a panel and blah blah blah. And I said, I'll do it, but I'm not going to do that. I said, this is the moment, right? It was maybe 3 years later that I had kept this article, and I said, this is it. I know this is when God wants me to pull this out. And I called Brooke Begance and Tomas Magana from the program in Oakland, and I said, we're going to have a summit in 2 weeks. Would you consider coming out, helping present Faces, work with us to help build a Faces for the Future program? And they said, yeah. And I said, yeah. And I said, yeah. I said, that's awesome. And I told them the whole story the same way, by the way. Mm-hmm. So, they knew what they were getting into, right?
I mean, how cool is that in emergency medicine that you have those types of opportunities,
right?
Right.
Totally.
I mean, you think about all the things that you've done.
Yep.
Like Michael in the last podcast talk about staying open to opportunities, and here are these things that Katie just finds and then actively pursues,
right.
Which fulfills her. And I think that if you see that in community emergency medicine to some extent, certainly academics is your experience.
I think you could do it. I think you could do it anywhere, though.
But I think that for those listeners who are interested in emergency medicine, I mean, it's such a fertile ground for those types of opportunities. It's the foundation of the hospital and the hospital healthcare delivery system,
right.
But it's also at sort of the fulcrum of many of the sort of social ills that sort of beleaguer our society, right?
Yeah.
So Faces for the Future is a 2-year longitudinal program. We have 32 kids now in it. They're getting their CNAs while they're in high school. Wow. They get academic credit. They come every Tuesday and Thursday. We have them. We actually got a hub at West High School that they've given us. And we have nurses who help teach that. I have an amazing program manager, Sheree Edwards, who runs that. And it's so great. And the schools and the principals we work with are so great and so on board. And we also integrate a lot of AIM with that. So AIM works a lot with the Compadres Network, which is based in sort of cultural healing and teaching and teaching how to be a noble person, a man or woman, based on your code and when that code is challenged, what do you do? We do healing circles, which is
Pete leads those.
Yeah, Pete totally
Pete leads those.
Yep.
I mean, I think that this sort of touches on that notion that these are resource-deprived environments. Mm-hmm. You guys provide resources, but then there's also this foundational component of personal accountability. Mm-hmm. Developing a code that they live by, developing sort of mature coping mechanisms, right? Yeah. And I mean, these are programs that don't just represent acronyms; they represent sort of paradigms of sort of a path forward.
Yeah, and Faces is not an acronym, but that's okay. Faces is not an acronym; it's just Faces.
It should be.
I know. Everybody thinks it is, but that
for all children
excelling
Societally.
But I'm over, I mean,
Faces.
I'm also over
Trademark it.
manage because the staff really does it. But the health interest program, which is an undergraduate program, and this year a couple of our FACES kids are actually in that program, which is super cool to see. And also MC Squared, which is a program out of Children's, but we have a cohort at Denver Health, 30 kids a year that come for that as well. And it really, the hope is that this will pipeline our community into our work, right, into our workforce,
Right.
so that we're living what we're preaching.
And we're genuinely investing in the future of our community and our specialty simultaneously,
Right.
with much to gain. And that is something I've long appreciated, admired for you both, is your genuine commitment to the community we live in different ways, but complementary ways in many ways. How many other ways can I say the word ways in a sentence? I'm new to the podcast hosting thing, so I don't talk that much.
Yeah.
And it's
But
so much fun, right?
I don't think this is a long-term fit.
Nah, I thought maybe face for radio, but it's just it's fine. You guys can host the next one. It's
You're cute.
Swing and a miss.
Dude, you're a good dude. I'm just saying.
I mean,
he is. No, you're
still
still
in the
the
room.
best.
I'm technically still in the room. Take your hand off his knee. That's so weird.
Yeah, true story. I've
So
actually
weird.
played footsie with Pete like 4 times in this podcast, and he has not refused it once. Just for the record.
I believe it.
Guilty
Believe it.
as charged.
But one thing that's really, I always say that the medicine is sort of the hook, right? Because we teach a lot of this stuff we're talking about right now, about what it means to be in medicine, and what that calling means, and how to sustain a career in that. And I think we have a unique opportunity because emergency medicine is super cool.
It's the best.
You get a
best job in the world.
student in the emergency department. I mean, I have people ask me all the time if I'll take a student and mentor or whatever. And I say, I will, but just so you know, they'll want to be an emergency physician. Because, once you get that in your blood and you see it and you see it's captivating, right? And so that provides a really great opportunity to say, yep, I got you now, right? Now let's talk about what's going on in your home. Now let's talk about why you're struggling at school. Now let's figure out, how we can get your grades up, or how we can help you navigate through whatever crisis is going on, because a lot of our kids have problems. But they're also incredibly resilient and smart and capable.
And to your point, Peter, that will benefit them.
Right.
That will become their
totally.
strength. That will become
I tell them that
their
all the time.
conviction down the line.
I tell them I can't take away your trauma. I wish I could, but I can't. But what I can help you do is use that to connect with others. And I'm expecting you to pay it forward what we're doing here, because you're going to be able to connect the way even I can't and other people can't, because
Right.
you come from those same experiences.
You mentioned earlier that Pete is a very kind of analytical person and tries to improve every day. And I just want to finish by saying I am better today for having interviewed you both. and we are better as a community and as a specialty
you.
because of you both.
All right.
And I think the highest compliment I can and probably pay you to is your kids. When Ryan and I came to dinner we cannot imagine or remember a time in which we've sat down with a family with 3 more kind, articulate, intelligent, well-adjusted, wonderful
Pretty awesome.
children. And there's that I think you'd agree is probably the highest compliment I could pay you both.
They're pretty amazing. Honestly, they're amazing. I don't know if I get credit, but, they're phenomenal. And I think they are going to, pay it forward.
Our world is better off for having you both, and I am supremely grateful that you've taken the time with us today. Thank you.
Bring
Thank
it in.
you.
Bring it in. Bring it in.
Bring it home.
Thanks, guys.
Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.